Dr. Sharfstein, let me go to Europe then as John leads off with that. Are you surprised at the challenges of Germany, Austria, and Switzerland?
I'm not that surprised because this virus is so transmissible. And what happens is as societies open up and people really think, okay, this is starting to be behind us, they go out and do more things, which is, of course, what they're supposed to be doing. But if you're unvaccinated, that's dangerous. And pretty much everyone who's unvaccinated is going to expect to get sick. And that's what you're seeing in these countries. Even though they have relatively high vaccination rates, it's just not high enough. And overwhelmingly, people who are getting very sick are people who are unvaccinated.
What I heard this weekend was we are 19 months on, depending how you count the calendar. Maybe it's even 20 months on from the beginning of this pandemic. Parse the unvaccinated 19 months on from the vaccinated 19 months on. It seems like the gap is getting wider and wider across America.
Well, certainly we're seeing a huge kind of political divide in vaccination, but it's still the case that there are people who are going out and getting their first shots, and they're getting it for different kinds of reasons. So I think it's important not to overgeneralize. I am still very concerned, though. I mean, and obviously the Aaron Rodgers fiasco, indicates this, that some people just have latched onto the idea that, taking unproven medicines is preferable to a proven vaccine. And there's just this undercurrent of, resistance to some unknown, vague authority that really appeals to people. And that can be very hard to dig out of. We see in the news stories that when people get sick, their whole families get sick. Sometimes they change their mind, but it's just going to be really important to understand this phenomenon and be more effective in combating it.
This is fascinating, Dr. Sharfstein. Are you saying that the Aaron Rodgers fiasco, as you put it, actually set back the pandemic and prolonged it materially by a certain amount of time by getting this message out there that there could be something that's harmful or nefarious about vaccines that have otherwise been proven?
Well, I don't know how much him in particular, what he just did in particular will hurt, but it certainly is not going to help. But it's combined with, terrible news coverage that you can get on certain stations about the vaccine, misinformation that is being, spread by people who really should know better, as well as the failures of Facebook and other social media to effectively control misinformation.
Dr. Sharfstein, we have seen a plateauing in the number of cases and hospitalizations, particularly out west in the United States, and there is this fear that perhaps we could see European-like cases go up here in America. I am wondering how far away you think we are to the end of the pandemic, and whatever form it is, as Janet Yellen is saying, is key to start to get some of those inflationary pressures down.
Well, I don't totally understand the connection between the pandemic and inflation. If one of the factors is the supply chain and the fact that we need, goods to move freely, people can't be sick and at home, they need to be out working, then, it's probably not just a U.S. control of the pandemic that's important, and it really is a global control. And we're pretty far away from global vaccination in a lot of places. So, I think to really feel like that we're in that post-pandemic world, whatever it looks like, we're going to have to get the pandemic under control in a lot of places. And that's going to require a lot of vaccination and probably a number of months before we get there.